If you take magnesium, vitamin D3, or K2, then you need to know this important information because it can greatly increase or decrease their effectiveness. And many people are not aware of this. I'm a family physician. Let's talk about what you need to know so that you get the maximum benefit from magnesium, vitamin D3, and vitamin K2. Now, if you haven't seen my other videos on magnesium and vitamin D3 and K2, go back and watch those after this one because they have very important information you need to know before you take these supplements. So there are two main factors that influence how well your body is going to absorb and utilize magnesium, vitamin D3, and K2. One of them is your diet, and the other is your health status, especially your digestive health. Let's start with the diet first. First of all, the most important thing you can do is eliminate Coca-Cola and other sodas with your meals, and especially with your evening meal. There's something in those sodas, whether it's the caffeine or some other chemical, but it definitely blocks the absorption of magnesium, vitamin D3, and K2. If you drink Coke with your dinner, you will block 90% of the magnesium that should be absorbed in that meal. So get rid of the Coca-Cola and other sodas. The second dietary factor that will greatly enhance the absorption of magnesium is increasing your animal protein intake. Now, this doesn't mean you have to eat like a glutton and overeat animal protein, but just bring it up to normal levels, especially if you've been on a low-meat or low-protein diet. If you're eating a normal amount of animal protein, say 3 and 2 ounces of grilled chicken breast or steak every day at dinner, you will have no problem absorbing magnesium. But if you're only having 1 or 2 ounces of chicken or 1 or 2 eggs at dinner, you may want to add some more animal protein to help your body absorb magnesium better. And again, this goes for vitamin D3 and K2 as well, so you want to make sure you have a good source of animal protein at each meal. The next dietary factor that can affect your ability to absorb these nutrients is making sure that you eat enough fat, especially at your evening meal. These nutrients are fat-soluble. They require fat in order to be absorbed and utilized by your body. So make sure you eat enough fat. 3 or 4 teaspoons of extra virgin olive oil would be great with your evening meal. Or you could use butter, tallow, or coconut oil. Just make sure you're eating enough fat, especially at your evening meal, so that you can absorb these nutrients properly. And lastly, on the dietary side, avoid eating too many raw vegetables, salads, leafy greens. Now, cooked vegetables, cruciferous vegetables, okay? Kale, spinach, arugula, even collard greens, Swiss chard, beet greens, these are all loaded with oxalates and phytate. These bind up magnesium, and they also can block vitamin D3 and K2 absorption. So you need to cook these vegetables thoroughly. Steam them, boil them, roast them in the oven. Don't just lightly steam them or lightly saute them. You need to really cook these vegetables so that you can break down the oxalates and the phytate so that they lose their ability to block absorption of these minerals and vitamins. Another point about salads and leafy greens: wait an hour after you eat your evening meal before you eat a salad. The reason being is that these vegetables have a lot of fiber which absorb water, and they can make you feel bloated and full and can cause gastric distension. So it's best to have a big salad an hour after your evening meal. Have it as a mid-afternoon snack, or have it right before your breakfast the next morning. But do not have it right along with your meal, because it can interfere with that meal's ability to be absorbed. All right, let's move on to your health. What kind of health problems can you have that will affect your ability to absorb magnesium, vitamin D3, and K2? Well, let's start with the most common one, which is a lack of stomach acid. If you don't have enough stomach acid, you're going to have trouble absorbing magnesium, vitamin D3, and K2, so you'll need to take an acid supplement, either apple cider vinegar capsules or betaine hydrochloride capsules before each meal to help you increase your stomach acid so that you can absorb these nutrients. Another condition that can greatly reduce your absorption of these nutrients is having too much inflammation in your colon or lower digestive tract. So any kind of inflammatory bowel disease or diverticulitis or irritable bowel syndrome, it can all reduce the absorption of these nutrients. In this case, you need to take measures to heal your colon and reduce your inflammation in your colon. And the best way to do that is by starting a low FODMAP diet. Now, I have a low FODMAP guide that you can download for free. I'll put a link to that in the show notes below. So go download that, print it out, and follow it for at least 2 weeks, and see if that heals your colon and allows you to absorb these nutrients better. The next condition that can affect your absorption of these nutrients is having a bacterial overgrowth in your stomach or small intestine. Now, the only way to diagnose that is with a test called a urea breath test. But if you have any symptoms of a bacterial overgrowth, such as bloating, burping, belching, gas, indigestion, heartburn, reflux, nausea, vomiting, diarrhea, you should take measures to kill off the bacteria. And the best way to do that is with a herbal called oregano oil. It's a very powerful antibacterial, very powerful antifungal. You take 2 capsules of oregano oil every single day, and that will usually take care of any bacterial overgrowth you might have. Next, having a fatty liver can block your ability to absorb these nutrients. So if you have a fatty liver, you need to focus on reducing inflammation in your liver and getting rid of the fat in your liver. And the best way to do that is by starting a low-carb diet and doing intermittent fasting. Next, having an intestinal blockage, whether it's a partial blockage caused by scar tissue or a complete bowel obstruction, can block your ability to absorb these nutrients. In this case, you need to see a surgeon to see if you need a procedure to open up that blockage. Lastly, any type of digestive surgery, including gastric bypass, can greatly reduce your ability to absorb these nutrients. And in this case, you need to take a multivitamin containing magnesium, vitamin D3, and K2. Now, if you haven't seen my other videos on magnesium, vitamin D3, and K2, go back and watch those now. And the platform thinks you'll enjoy this video on thyroid hormones. Check it out.